Excellent. Well, welcome to another amazing podcast here at Mishti. Today we have an incredible doctor, Dr. Aarthi here, who is a geriatric medicine practitioner. She studied geriatric medicine in Stanford and is currently working with Apollo in India. And today's conversation is all about geriatric care. So thanks so much, Dr. Aarthi, for being with us here today and sharing this amazing information that we're about to discuss.
Hi, thanks for having me. I'm really excited to meet you and meet all of the members from Mishti as well as all of the members of the Mishti community. So a big hi to each one of you, and I hope you're having a good day. So I'll just go ahead and let you introduce us and what we're trying to achieve
Yeah.
through this podcast.
Perfect. So again, geriatric care. In fact, a lot of folks in our community and outside haven't necessarily come across the term geriatric care. So I wanted to maybe start off with the first question about what's geriatric care and why is that different from an elderly person seeing a regular doctor? What makes the distinction between the two?
The word geriatrics, I would say, if you had to go over something that is very easy to understand, the geriatrics is the opposite of pediatrics. So if you have a specialist that's dedicated towards the care of young individuals, you
Mhm.
also need a specialist that's dedicated towards the care of older individuals. And I mean by older, the general definition is people who are 60 or 65 and above in age. So this is a fairly new specialty because the world has recognized that elderly individuals, especially more developed nations, have recognized the need for care, dedicated care for elderly individuals, because their physiology, the way their body behaves, their unique medical conditions are very different from that of younger age groups. Let's say somebody who's 40, their body is not the same as somebody who's 60. The other aspect of it is that geriatric individuals also have more factors that sort of play into their care and their well-being. And that would be not just medical, it would also be social, financial. It's a myriad of issues that sort of decides how their care and how their course in healthcare actually goes forward. So a geriatrician is somebody who's trained to look at all of these different facets of what plays into a elderly person's health
Mhm.
and addresses all of those as a whole and comes up with unique individualized solutions to help each individual, each elderly individual achieve the best health and healthcare that they can get. The other thing is, I think geriatricians by nature, like the kind of people who come into elderly care, are those who are passionate about it. You
Mhm.
can't get into this field if you don't actually love it, because it's either amazing or it's really bad.
Right.
And if you love it, it's the best thing. It's one of the most wonderful things you can do.
Yeah.
So I think it does take a lot of personal dedication and like personal passion to get into this. So that's good. And then you also have the aspect, I mean, other than the personal aspect of it, geriatricians are also trained in a system called as value-based care,
Right.
as opposed to looking at large volumes of patients, large numbers of patients.
Yeah.
We focus on giving high quality care to each individual that we see. How
Right.
does that actually look?
Yeah.
We take into consideration a patient's preferences.
Mhm.
We try to advocate for them as opposed to telling them what to do. We actually listen to them and work with them to help them achieve good health, and also give them time, because time is one of the most, I would say, scarce resources in today's world in healthcare. So we're trained to give longer, more detailed visits to give something called as comprehensive care as opposed to just piecemeal like 5 minute, 10 minute consults.
Right. So you and from what I've also sort of observed through members who have visited you, the consultations are typically much longer, much more involved and in depth, where you get a much more comprehensive sense of their well-being, and you aren't necessarily rushed to get to a solution immediately. You're thinking through a progressive improvement to a destination as opposed to like a piecemeal correction of issues. Would that be fair?
Absolutely. Absolutely. That's 100% accurate. And I think the reason being, you don't have to get all the solutions at one go. You're
Mhm.
looking at a longer relationship with this elderly person who you're working with.
Yeah.
You're not working for them. You're not, it's not like a, sort of a transactional relationship. You're trying to develop a relationship where you become their advocate for life.
Right.
And if you're achieving that from within, then all of your actions and everything that you do is in concordance with their preferences and their wishes.
Understood. No, that's really helpful, and that helps create the distinction between a regular doctor visit versus the way and the approach of a geriatric doctor coming into the mix. I'll perhaps ask you another rather cheeky question. You've now seen a lot of senior folks who come to you for consultations. What are the common kind of misconceptions or common traits and habits that you see that people aren't really even aware of are things that they should probably reconsider?
I think I think this is something that would be, that has so many answers, but I can give you a few examples of what comes to my mind at this point. One of them would be, people tend to think that if you go to a doctor's clinic, they're just going to prescribe tests and medications and procedures, and like that's what healthcare is about.
Mm-hmm.
I mean, the whole concept of healthcare has been lost over many decades.
Yeah.
We have moved from a system of healthcare to disease care. We look at disease. We
Right.
look at, okay, how do we manage this chronic ailment? And even the pharmaceuticals and every part of every sort of, cog in this system has
Yeah.
moved towards how to maintain people in a chronically ill state, as opposed to how to get them to live healthy.
Yeah.
How do we focus on the basics like education? So going to a doctor is not to be equated with tests and let's looking at just ailments and medications.
Right.
It's not true that all doctors only focus on that. There is a large number of doctors out there who want to help you focus on living a good lifestyle through preventive care, through health education, even helping manage chronic medical conditions. Like, it requires some amount of ownership, and we expect, or rather we depend on that ownership that patients take in order to help their own participation in healthcare, so that they don't have to come and visit us, so that they don't have to keep coming to the hospital.
Yeah.
So that's one of the myths I encounter.
Right.
Doctors are not all out to get you tested and like make you undergo procedures. The other myth I often sort of no, it's not a myth. I think it's just a practice. It's a way of practice. We think that getting tested, right? Like, even if we don't have any symptom, getting like a whole battery of tests done without any clinical reasoning behind it, or without any actual examination, evaluation, exactly, without an actual thought process, it's a good thing. Why this is not a good thing is because sometimes, like, more is not better. More is just more.
Right.
You may just be stuck with values and like test results that you don't know what to do with.
True.
And for the sake of medical legal protection, today's healthcare is wired in such a way that if you find an issue with like a particular system, or like like the liver or anything, you have to go to the specialist.
Right.
This just adds like a burden of having to run to different specialists and get a lot of tests for something we needed.
Right.
There are some diseases for which we need to screen in general, because the risk of developing those becomes higher as we grow older. But then you don't need to go ahead and do a sort of a screening test for everything.
Right.
Exactly. When it's not necessary. So more is not always better. The myth that more is better needs to go away. More is sometimes just more.
Right. That's refreshing to hear, actually. maybe if I use that as a perfect segue to my next question, for folks who are like, I say senior with tremendous respect for seniors, over 60, that I prefer calling them experienced, but hey ho, in the medical system, that's what we call them. What are the kind of tests that you think are good that they should consider doing and should be regular part of their healthcare regime? Is there anything that you would recommend that they should consider once they get into, as they get older, just because of the higher propensity to certain risks?
Some tests are not necessarily done, through like blood tests, urine tests, or imaging. Some tests are very basic. Like, for example, everybody should get their blood pressure checked when they're older. When you cross the age of like even 40, I'm not even talking 60, I'm saying even 40, it becomes important to get our blood pressure checked, because hypertension is one of the most prevalent lifestyle diseases.
Yeah.
It's associated with a sedentary lifestyle. That means sitting down for long periods of time, working indoors, not getting enough physical activity, being overweight, eating food that's loaded with salt.
Yes.
And this
Which
is like
is our diet.
packaged food, absolutely pre-made food, restaurant food, food that we get from like our, anywhere, like anywhere outside, or even that's cooked by somebody who's not a family member, who's not thinking about our well-being.
Yeah.
Um, so all of these things, they add to the risk of high blood pressure, which can just be diagnosed simply by a regular blood pressure check, maybe once or twice a year.
Okay.
With growing age, the risk of high blood pressure increases. Therefore, it's prudent to get tested at least twice a year. Then there's also, when it comes to blood tests, I would say getting your thyroid function tested, kidney function, and getting screened for diabetes at least once every year is important, because these are the organ systems where we tend to see more abnormalities as individuals age.
Right.
In addition to that, like, even though this is not really guideline driven, because there is no firm guideline or consensus across the world as to, what needs to be done in an elderly individual. Different societies agree upon different things.
Right.
What I would say is, like, this is a good basic sort of thing to start off with, and then meet a physician or meet a geriatrician to assess your individualized risk factors.
Right.
Let them examine you, assess you, and sort of have the discussion, one-to-one discussion, as to what you should get tested for. That's what I would say.
Okay. No, that's very helpful. And that actually limits, there are the very basic ones that you should do as you're getting older. And then what might be specific to you based on your lifestyle, based on your risk factors, a good geriatric doctor should be able to recommend the absolute right amount of tests that you need to do, as opposed to doing more is more in as you mentioned earlier. Let me take you to the next question, Dr. Aarthi. You've seen both sides of the world. You've been in the US, studying geriatric medicine. You have now come to India trying to implement geriatric care in Apollo. What are the differences that you see between two societies here when it comes to geriatric care? Any interesting disparities?
That is so large, and it's an important topic to discuss, because I feel like every society can learn from each other.
Yeah.
Whether it's the eastern part of the world, the western part of the world, we all have differences. I don't look at it as one is better, one is worse. I feel like everyone is different, and we all can learn things from each system.
Yeah.
So I could start with the US, because I've spent the earlier part of my geriatric career there, and then I moved here.
Yeah.
So I think the good part about the US is that they've recognized the need for geriatricians earlier than most other countries. They also train the most number of geriatricians. They also have the most number of qualified geriatricians serving their communities. And COVID sort of also helped us realize the importance of senior care specialists or geriatricians, because there is not, folks don't have enough time to keep running between different doctors. It's too much work.
Right.
So somebody who's your advocate, who looks at you as a whole individual, it is so necessary. And I think that the US has recognized that need and is training more folks in that area. So I like that the system is sort of well molded to geriatric care in the United States. They're very good with continued care, as in like outpatient, inpatient, as well as post-acute care and care within the community, whether it's nursing homes, assisted living facilities, or individuals' actual houses. So it's sort of a continuum that is very well established in the US.
Right.
And I like that. When it comes to preventive care, I feel like, the world as a whole is, struggling. Whether it's the US or in India, the struggle is real. It's everywhere.
Yeah.
What I feel like the US may, need better, or rather what they can do better, what can be done better, is costs. So, the heavily insurance driven, like cost heavy system, geriatric care, it's just unaffordable. Sometimes people can't, they don't have that kind of money, and it becomes impossible to, avail of care. That's one thing. In India, what I love is actually, the fact that you can get good, well-trained doctors, because India has, makes so many doctors. It's such
Yeah.
a reputed profession with so many medical colleges, so many trained doctors. So the availability is there, even though the ratio of like doctors to patients is very low.
Yeah.
But you have some of the best trained doctors, and then you have like affordable care for the most part.
Yeah.
It's very individual driven. You can decide to go in, get tested versus not get tested. You don't have to go through a lot of bureaucracy if you can afford, like, going to a good tertiary care private hospital, for example. A
Right.
lot of like good government hospitals and public healthcare systems which are also very robust and excellent.
Right.
Where I feel, India, like the Indian geriatric system can do better is because it's still in the stage of conception. I feel like we have a long way to go.
Right. Yeah. The journey
We
only just
still
begun. Yeah.
Exactly. We still have to, we still have to address the gaps in care. We have
Yeah.
to recognize like how to scale geriatric care.
Yeah.
If there's like a dozen or a couple dozen fellowship trained geriatricians across India,
Yeah.
how do we scale this?
Yeah.
How do we help more people achieve geriatric tenets of care within their daily practice? So, internists, general physicians across the board can deliver geriatric care. That is the true goal.
Right.
Everybody, every single physician, surgeon in the country should be a geriatrician, because it's an important aspect
Yeah.
of care in general. Whether you're a colorectal surgeon or a urologist, or you're a gastroenterologist, an orthopedic surgeon, you just come across elderly people everywhere.
That's part of the big vision for Mishti as well, right? So the thing that we believe uh, we can do better in partnership with geriatric specialists like yourself is bring that level of community care to everybody that's part of the community, bring education as part of their own well-being education, their own health education as part of their day-to-day practice, because when you're informed, you make informed choices and you don't fall back into doing things that you know are necessarily not heading you in the right direction or detrimental to you. So I think it's fabulous that we are able to find incredible doctors like yourself to partner with to get that kind of care down to community grassroots levels, which is where I think the big change happens, right? Yes, a lot of people don't necessarily have access to the Apollos everywhere. Our hope and desire is that any senior individual has an incredibly healthy, fulfilling life. And a big part of having a fulfilling, thriving life is being well. And being well doesn't necessarily mean just medically well, it means health, mental, and social well being altogether. And to your point, geriatric care is not about just disease control, it's about wellness altogether, right? So I think it's a brilliant marriage of ideas and visions here to try and make the wellness of our senior community part and parcel of our vision, right? So it's really refreshing to hear that. May I ask you to give us from your perspective, now having worked with so many seniors, what looks to you to be a good lifestyle choice? How can seniors think about they have long days as well. A lot of them are very busy, a lot of them are not as busy, but what would be a good practice or habit for them to develop through the course of the day that you would recommend people to just at least have a benchmark lifestyle thought process?
I would say one of the significant findings, or one of the significant things that keeps coming up every day, as we read more and we understand the importance of moving or walking, just
Yeah.
simply walking. Because walking is not just good for the heart or the brain or the kidneys, it's good for the mind. It
Mm.
is one of the most tried and tested, solutions when it comes to preventing cognitive decline, as in like memory issues or dementia with age. We also, I mean, I would say it's one of the only evidence-based measures to control or prevent cognitive decline as we
Wow.
become older. So just as much as 30 minutes to 45 minutes of walking a day can do a lot of magic. And it's all about being consistently active.
Right.
The second thing is, a lot of neurophysiological, studies and inputs have suggested that walking actually boosts mood. It's so good to
Yeah.
mitigate the effects of depression, because most of the walking we try to do dedicated is usually outdoors.
Yeah.
And outdoor stimuli with social stimulation, with the wind, with the forces of nature, with the sun, and all of those things put together is
Yeah.
actually a great mood enhancer.
Mm-hmm.
So walking is one of the most effective preventive measures for cardiovascular disease, for cognitive decline, for any kind of like arthritis related issues, lack of mobility, loss of muscle. All of these things can be mitigated by just walking 30 minutes a day. Then I think like one of the other important lifestyle measures is, people often ask, what should I not eat?
Right.
Or, what should I cut down? I
Yeah.
mean, that answer really depends on what each individual's risk factors are. But what comprises of a rich diet? What can you eat?
Yeah.
A diet that's rich in vegetables, in sprouts, in dal, like lentils,
Right.
in even fruits. Of course, if you're not like an uncontrolled diabetic, fruits still remain an important part of your daily diet.
Mhm.
Um, Nuts are really good,
Okay.
even though many nuts are rich in what we call as saturated fats. Those are not necessarily all evil. Like the blanket term of like saturated fats being bad is not always, it's the blanket term is not true.
Yeah.
The kind of fats that are really bad for you are the ones that are, heated oils, like the oils that we use to heat in
Yeah.
daily cooking,
Yeah.
um, fried food, processed food, the kind of fats that are present in cookies and cakes with
Yes.
like cream and
Yeah.
butter.
Yeah.
Those are the ones to avoid and stay away from.
Right. Right. Okay.
So I would say just include vegetables, include fruits, include nuts in your diet, include legumes. Foods to avoid, of course, I would say like, limit or avoid the intake of meat, alcohol, caffeine, basically coffee,
Yeah.
even fried foods, bread, sweets,
Yeah.
sugary foods, all of these things. I know
Uh-huh.
coffee is like one of the things is like
I
a
know. When you
lifestyle.
said coffee, my heart just jumped. I was like, no, don't take coffee away.
I wouldn't say you have to stop coffee, but limiting coffee is actually, I have personally tried limiting or cutting down on coffee recently, and I have seen tangible effects of what it has done to me. It
Yeah.
has significantly helped me reduce anxiety, helped better my sleep quality,
Yeah.
helped better my mood, my response to anything, made me feel a lot fresher.
Right.
Um, Even though we get used to this whole concept of morning coffee, it's okay. Like having a cup of coffee is not bad.
Yeah.
But making it a go-to for every
For your
social event,
Kickstarter, that's true. That's true. I think it's the more dependency on it that makes for it to be a bad habit. And of course, you're right. And that's true even for me. The minute I see myself sort of over caffeinated, I can see the sense of jitteriness even in me. So I can only imagine, and this is me after I work out almost every day. I
yeah,
can only imagine somebody who's not working out, the level of, stress. And because a lot of that, if you're not expending it, is actually building up, and of course isn't great for your body if it sits inside. So no, totally understand. So yeah, walking, this is news to me. I didn't know walking is actually one of the sort of at least verified ways of preventing dementia. And it makes complete sense. You're out, you're about, you're feeling the wind, you're meeting people, you're getting stimulated, looking at the world. As you mentioned in terms of diet, great to bring in more green leafy vegetables, bring in fruits, have the nuts, stay away from saturated stuff that is sitting inside cookies and processed foods. A lot of it is actually sort of is obvious and intuitive, but you almost need a encouraging and reinforcement of that message to people. And I know a lot of our Mishti members are very, very diet conscious and make sure that they are always, looking to have a very healthy diet. But it's just nice for them to hear the fact that encouraging them to think about adding more fruits and adding more nuts into their diet may not have been something they considered, but certainly worthwhile for them to be aware of.
there's like a very easy way to actually achieve this. A lot of people ask me how do I refuse? How do I not have sweets and snacks? And there are people gifting it to me on
Yeah.
occasions.
Yeah.
How do I avoid it? Simple thing is like just don't accept foods that are not good for you. Like, would you accept a person who's threatening your safety into your house? You wouldn't. So why allow like a bad food into your body? So
Yeah.
just politely, like, learn to politely say no and decline if it's food that's not good for you. And you can always offer them a choice saying, I love nuts. Like, I really don't mind, getting like a box of cashews from you. I would absolutely love it.
Yeah.
So, the person who's giving something doesn't feel rejected.
Yeah.
And then the second thing is, if you do, don't buy those foods. Like, just don't buy them.
Yeah.
If you
If
go to
it's
the
not
aisle in
there,
the store,
yeah, you don't eat it.
just let it be. It's okay. It's good to look at. Just don't touch it. It's
Yeah.
fine.
Yeah.
The third thing is, if you do have it in your house, how do
Yeah.
you stop yourself from snacking on something unhealthy? Keep the fruits and the nuts and like the healthy foods invisibility. Like, make sure that they're visible
Right.
on the table, on the kitchen counter, like that kind of stuff. And then make sure that the unhealthy foods are put all the way back in the shelf, closed.
Yeah.
That helps a lot, because then the unhealthy stuff sort of like grows old. You may not remember it, and then you eventually have to throw it out. So that's good.
Yeah. No, Dr. Aarthi, this has been a very valuable session. I think a lot of our members are going to very much appreciate your thoughts on what geriatric care is, how to take care of their life. And it's not about disease control, it's about wellness. And we need to bring back the focus in the medical community as well as our own communities that we're part of on how important wellness is to us as opposed to disease control. So thanks once again. It was a pleasure having you. I'm sure we're going to have lots more of these. But enjoy the rest of your day and really appreciate your discussion here.
Yeah, absolutely. It was nice talking to you about this. I feel like we could do this all the time. I mean, we're passionate and we have our ideas together. I think this has been great. Really happy that you organized this.
Thank you. Thanks a lot.